you have one dog, it has 4 puppies. 6 months later, all those puppies have more puppies, and you just keep it truly goes up exponentially. So anything you can do to slow the growth and allow us to get ahead of the curve helps.
Mayor, if I can also say that part of what BARC's already doing as part of our additional investment is an educational component out in the community. So BARC is already actively working on that awareness and education, to the mayor's point, to lower some of those numbers in the front end. So that's already ongoing. That's part of the commitment we made to BARC last year. So we've got.
Oh, and things like that. Truly, they don't know that it's against the law to allow your dog to run loose. Those kinds of conversations have to be had.
And also the 48-foot mobile clinic that Emancipet is bringing to Houston will be stationed at Ripley House. And again, I want to thank Neighborhood Centers for partnering with Emancipet and the City of Houston on this. But that 48-foot mobile clinic will be at Ripley House 6 months to a year. And then they will transfer that to another area of the City of Houston that's having a stray dog issue. But Emancipet is committed to building or leasing a clinic in the area around the East End to continue providing low-cost spay and neutering. And they're committed to building at least 3 or 4 clinics in the Houston area, which will also then provide hopefully 7,000 to 8,000 spay and neuterings in those clinics as well. So this is a big step.
And this is definitely scalable, as you already heard, and also changes that we made to our local ordinance last year to more proactively address dangerous and aggressive dogs, where we empowered BARC to be able to do that by working with community members that sign an affidavit and identify where some of these problem areas are, is being very helpful. I talked to some of their staff yesterday, and in fact some of that language is being used as models for state bills that are being proposed as well. So I think Houston's really leading on this issue.
The question might be appropriate for Ms. Mills to answer. Can you talk about the affordability? If you step to the mic and talk about the affordability of this. How much is going to be charged at your facility compared to what I might pay at PetSmart or whatever to get that dog fixed?
Yeah, it's a great question. So what we know nationally is that families that are earning $40,000 a year and under cannot afford what we would call market rate spay-neuter services at a private veterinary clinic. So our pricing is designed for families that are earning that amount. Most of the statistics also suggest that $65 is on the high end of what people can afford. Our pricing model is different for dogs and cats and spays and neuters, and it basically goes from about $35 to $65 for the entire spay-neuter procedure. But again, we also don't turn anybody away because they can't afford to pay. Most of our clients pay our fees because $35 to $65 is really affordable for the target population that we serve. But when people come into one of our clinics, we have several clinics in Central Texas right now, if they only have $20, we find a way to work with them. And the way that we do that, because we're a nonprofit, we get our revenue from the fees that we charge for services, but also through donations. So the generous members of the community who want to support the work make donations to us through fundraising and through direct kind of events and things like that, and that allows us to subsidize the services we provide.
But you're also not a full-service veterinary.
Correct, exactly. We provide spay, neuter, and preventive veterinary care like vaccines and microchips only.
Pardon my ignorance on this. Well, how does that compare to what I might pay if I were to go to a
market rate spay neuter prices vary widely. In some communities we've looked at, the pricing varies from $150 on the low end to $900 on the high end.
Okay.
So it's because private veterinary clinics are all covering their own costs, and their own costs vary so much. The pricing is pretty diverse that's out there.
Yeah. But it's safe to say that across the city of Houston, it's above $100 and 100 to 200 probably is the average.
And so what will a person do when you get the trailer set up? Do you all go through the neighborhood and say, come in this day, or do you have to make an appointment? How will the people actually work?
Great question. So all of our services are by appointment. So we have a main number and a website, emancipet.org. We also book appointments in a variety of different ways, but yes, we do. Our outreach is a really big component of what we do. At Emancipet, we believe that there are people out there right now in Houston who will jump at the chance to get their pets fixed for these low prices, but there's also folks out there who don't yet know about spay-neuter, and we need to reach them through our door-to-door outreach efforts. And so we're hiring, starting today, we're officially looking for staff, and one of the staff people we hire will be an outreach person who will have their job as going out every single day, door-to-door, inside underserved neighborhoods, to share information about all of the services we provide, as well as other needs for animals, as the mayor was saying, to help spread more information in the community.
Since BARC started the Fixing Houston program, has there been an increase in people bringing their dogs in to spay and neuter? Because a lot of it is still a culture that...
Yes, but that's why I was looking around for Greg, so he's not here to answer that question. But it is, we are trying to change the culture, and that's a slow process.
Yeah, expanding on the issue of culture, as I'm sure you're very well aware, every culture has a different attitude toward cats and dogs, ranging from considering them part of the family to other attitudes. The fact that Houston is such a diverse community will mean that this program is going to require different outreach approaches to different cultures. Are you addressing that?
That's actually why the way we started with our Healthy Pets, Healthy Streets initiative. We learned from the first neighborhood, which was in Mayor Christine Gonzalez's area on the north side. We then went to Councilmember Davis's, going from a largely Hispanic community to an African American community. We had the messaging changed a little bit, and so yes, we are targeting the needs of the neighborhood.
And we saw great success. I was out there many early mornings, and people were lined up as early as 6 a.m. Sometimes we had to make other arrangements so that we could make sure we were accommodating them. But the demand was there. People wanted. They were talking neighbor to neighbor. BARC did a great job of doing outreach. In fact, I think a lot of that's what prepared us to then staff up in some of those areas once the funding became available, to make sure we were doing outreach on a regular basis. And so the model really has worked. So we see that even in communities that you would perhaps think that weren't going to be interested in the service, once the accessibility is there and once it's the right price, either affordable or free, people really stepped up and wanted to take responsibility and do what was right.
Okay.